Hi, and welcome to the Focus on Healthcare event. I'm Jeff Young, National Director for Healthcare at Gardaworld Security. I'd like to just take a few moments today to just acknowledge our frontline healthcare security workers. I believe they're the unsung heroes supporting a safe environment of care during the global pandemic. As we as a society battle the global pandemic and follow the direction of governments, health experts, and our individual employers to reduce contacts and potential exposure, which may include things like when out in public, wearing of a face covering, hand sanitizing it when you enter facilities, keeping in small cohort groups, eliminate or reduce travel, and also working remotely from home, which I am doing and I'm sure many of you are doing. In addition, we also see a decreased overall workforce as employers unfortunately furlough, lay off, or even terminate employees as business revenues drop. As society does their part, we in healthcare and healthcare security battle what I'd say is almost in opposite directions. Our frontline staff can't work remotely. Mandatory wearing of face coverings and other personal protection equipment, sometimes for the entire 8 to 12-hour shifts. And we put ourselves in the epicenter environment for COVID exposures. All the time, the need for security staffing and healthcare staffing in general increases. Recently, I took part as a presenter in an IHSS webinar, and we've solicited feedback from the membership prior to the webinar on some of the duties that they're seeing the security staff in healthcare adding on. And you'll see a list here on the next slide of some of those duties that has changed within the healthcare environment. You'll see reassignment of security staff to other posts or other duties to support the global pandemic. In addition, we've also been asked to take on other duties related to screening, whether that be patients entering the facility, visitors, or employees, screening with thermal temperature guns or hand sanitizer as our visitors enter. Delivering COVID tests to other sites. We're seeing standalone COVID testing centers in which our security staff have been asked to staff as well. Also, our members reported a small uptick in behavioral issues on site, increased in overdose calls, and an increase in verbally and physical aggression calls as well. So I think in general, or in summary, healthcare security's role has changed during this global pandemic. And we must support our frontline healthcare security staff and do everything within our power to keep them safe. We need to ensure that we have ample and appropriate personal protection equipment for our staff. If our staff are sick, they need to stay home and self-isolate. If they're showing symptoms of COVID, they need to get tested. And also stay within their small cohort group, both at home and if possible at work. And what that means is we should assign our healthcare security staff to a single site, preferably the same shift with the same team members. We've seen this play out in the long-term care environment, where it's quite common for our clinical staff to work at multiple sites. And unfortunately, it's been a cause of the spread of COVID between some long-term care facilities. And also often overlooked is we need to also support our employees' mental health well-being as well. And of course, follow any federal, provincial, or local protocols that are put into place. And finally, we must acknowledge and thank all of our frontline healthcare workers, and this includes our security staff. Those that know me know I have many sayings, and one that I've said in the past and continue to say is I'm a healthcare worker. I just happen to do security. So on behalf of Gardaworld, I'd like to thank all of our Gardaworld healthcare team members, but not only them, I'd also like to extend a thank you to all of the healthcare security teams out there, whether they be proprietary, in-house security teams, or working for other companies. I'd like to thank all of you for the job you're doing and keep up the great work.